Hi everyone, my name is Harmony Smith, and I'm going to be talking about possible visual deficits that could follow after a brain injury. So, an overview of the visual processing within the central nervous system is an important foundation to know before we get more in depth into this. So, visual processing has a lot of aspects that go into it. It's essentially the raw material of vision must be transformed into images of the surrounding environment that can be compared with stored memories, combined with other sensory input and knowledge, and then be used for decision making. So this has a very specific track that it goes to that you can see on the second point. There's a circular processing route, light enters through the cornea. These are things that we've learned about before and that we just need to keep in mind. In addition, we also need to know that all CNS areas must work together for a person to make sense of what is seen and use this information in order to adapt, which is so important for OT. So, how does OT handle this? Well, the OT must, when it comes to the evaluation, the OT must link limitations in activity and participation to the presence of a visual impairment. So it's not just the visual impairment that all of a sudden makes someone needs OT, right? It's that there's a visual impairment that is causing, a limit in participation or activities. That's what the purpose of the visual performance assessment is. You need to establish medical necessity for this. You must also be able to identify a limitation in occupation and connect it to the presence of visual impairment, very similar to the one above. OT practitioners assess visual impairment to explain the presence of that limitation. So, if you're dealing with something like this, the reality is OT must be very well versed in basic visual assessments in order to screen for visual impairments. They need to know exactly. This is kind of a specific field, so they need to know exactly how to justify the info that comes after the referral and link the presence of limitation in occupations to that visual impairment. So after the evaluation, we know intervention comes next, and the focus of this is to change the outcome in the categories of visual disability and visual handicap. So you're going to use this in conjunction with a lot of client education. So the approaches that we want to use are remediation and compensatory. So remediation is used when you want to establish or restore the client's ability to complete visual processing. This is helpful for things like efficiency of visual search or improving visual attention. Whereas for compensatory, we know that this is when you want to enable the client to successfully use his or her current level of visual processing. We may not think that it can be as fixed per se. So, optimizing motor planning and performance in clients with neurological disorders. We're moving away, kind of moving away from visual processing. I'm going to talk quickly about this. So, it's important to know the motor characteristics that make up CNS dysfunction. It's very important for OTs to be familiar with such things. So, how OTs can provide intervention to those with difficulty in motor performance. Well, we can either optimize that motor function or we can integrate improved motor skills into enhanced performance of functional activities for greater independence. So there's upper motor neuron dysfunction and there's lower motor neuron dysfunction. We talked about this a lot in our neuroscience class, but for upper motor neurons, a quick review is that the adaptive features of this are disorders of movement that develop in response to a person's attempt to move within the constraints of limited mobility, specific weakness, or hypertonicity in specific muscles. So the constellation of movement problems are associated with a brain injury. Whereas lower motor neuron dysfunction describes the weakness and flaccidity that is associated with peripheral nerve damage. Continuing on, some definitions, you know, primary motor impairments can be negative or positive. Negative is like paralysis, sensory loss, fatigue, decreased movement speed, um, kind of things that are being impacted or not there. Whereas positive impairments are spasticity, the presence of abnormal reflex activity, ataxia, intention tremor, things that are popping up that are present. There's also secondary motor impairments, which are just preventable deficits that develop over time in response to immobility, inactivity, or asymmetries in postural alignment. Motor control is associated with deficits in higher order processes such as motor planning and motor learning. And then lastly, motor execution is just associated with specific impairments that you can look more in depth in the book. So interventions that target these kinds of things, the sequence is as follows. You want to analyze the performance and determine limiting factors which can change through therapy, prevent or reduce factors through intervention and education, design activities for use as challenges promote development of effective movement strategies, adapt physical environment to promote max function, assist clients in developing strategies for approaching or mastering motor challenges they wish to perform in the future. So, what exactly is matching the task demands and the person's capabilities? I thought this little definition chart was very helpful. It gave a very clear example of what task-based, task-related, activity-based, goal-directed training kind of is. It's when the client selected goals are used to provide opportunities for problem solving and to indirectly drive the movements required to meet the task demands. So this criteria for that therapeutic task is that the task must use natural objects whose affordances are clear to the client. They need to understand what they're doing, of course. The task inherently allows for repetitive actions that vary with natural changes in task demand. We talk a lot about repetition in OT. It's the key to mastery. The task is well matched to the client's current motor abilities and therapeutic goals. And the client fully understands parameters related to his or her own position and the placement of task-related objects. So that's all I have to say. And the next part, we'll talk a little bit more about our e-portfolio. So thank you for listening.